I'm Dr. Eileen White. We're here at the Rutgers Cancer Institute, where I am Deputy Director and Chief Scientific Officer, and I'm also Associate Director of the Ludwig Princeton branch at Princeton University. The Rutgers Cancer Institute houses the clinical activity and clinical research for the investigators at the Ludwig Princeton branch focused on cancer immunology and metabolism. So we've known that cancer is a metabolic disease. It's actually several hundred different diseases. For example, breast cancer is not the same as prostate cancer and lung cancer. We've also known that some of the original anti-cancer drugs that were developed are anti-metabolites. So why not build on that and get a thorough understanding of cancer metabolism in all cancers?
There's probably no worse thing you can hear as a patient than you have cancer. And so I think it's incumbent on us as investigators, as clinicians, to understand that and from the beginning wrap a blanket around that patient and try to lift some of that burden off and to provide hope. What's important for cancer researchers and cancer clinicians is to always keep the cancer patient front and center.
The best way to address the cancer burden is to take discoveries in the laboratory and move them into the clinic. And the two trials ongoing now are to measure metabolism in patients with cancer. One is in pancreas cancer and the other one is in breast cancer. And so this involves infusing the patients with glucose, the tumor fuel, having surgeons remove the tumor, and this can give us important information about the metabolism of a particular cancer. For pancreas cancer, this is particularly important because most of the cells in the tumor are not tumor cells. By examining spatially what is the fate of glucose in these tumors, we can specifically look at what's happening in the tumor cells versus the non-tumor cells and get a better understanding of not only how is the glucose being used, but who is using it and what are they using it for. And in breast cancer, understanding fuel usage might lead to a better understanding of tumor metabolism in that terrible disease and open up novel opportunities for interventions. One of the main functions of the Rutgers Cancer Institute and the fact that we're an NCI-designated comprehensive cancer center is it brings everyone together between the research and the clinic. For example, if someone at Princeton University wanted to perform a clinical trial, we can help them connect with the appropriate clinical investigators so that they can move their basic science discovery into the clinic. This bidirectional communication is essential for efficient and productive and innovative cancer research. And Ludwig Princeton branch and the Ludwig Institute for Cancer Research funds groups of people that are working together. That is the most efficient way to tackle a very complicated problem. The complexity of cancer is enormous. That's why these multidisciplinary teams coordinating and communicating their research is the wave of the future to tackle cancer as a systemic disease.